Hi, my name is Keisha Costa, and I'm an RPN/CHD, meaning Certified Hyperbaric Technician at the Rouge Valley Hyperbaric Medical Center. Basically, what the chamber gives you is 3 to 4 times the amount of regular oxygen in the chamber. In a normal environment, you're only breathing in 21% of oxygen, 78% of nitrogen, and 1% of any other gas that's floating in the air. In the chamber, you're only getting 3 to 4 times the amount of oxygen, and you're only getting oxygen. There's no other gases that's inside the chamber except for oxygen. That oxygen inside the chamber is under pressure. The pressure that's given inside the chamber is what your body needs to push the oxygen into the deep tissues of the body. That's giving you that oxygen that you need to help to revive the tissues, giving you extra blood vessels to help to regenerate the area of your body that is required to regenerate. The response rate varies patient to patient. We've seen some patients with significant improvement in the first 10 treatments, and we've seen patients takes a longer time. Sometimes the improvement that's going on below the surface of the patient that's visible to the eye. So some patients will have a wound and they'll say, oh, after 30 treatments, I don't see any improvement. But it doesn't mean that there isn't improvement. It just means that there isn't visible improvement. Sometimes the wound is more damaged, there's more damaged tissues on the inside of the body than you're seeing before you can see improvements to the wound itself. Hyperbaric treatment is not the only treatment for a wound or for other indications. Hyperbaric treatment is the only treatment for carbon monoxide poisoning, nitrogen narcosis, which is called the BENS, and also blood loss anemia. For all other indications, it's part of the treatment. So people will think, oh, I have a wound and I'm going to hyperbaric treatment, so therefore I don't need to do proper wound care. But it's not the overall treatment, it's just a part of. So hyperbaric treatment along with wound care, infection control, making sure that your dressings are getting changed when they're supposed to, and somebody is monitoring those wounds. So it's not the only treatment, except for the 3 that I've indicated earlier.
So I've got a foot issue on my left foot, and this is not a first. I've been through a couple of sessions with the hyperbaric before. It's the same foot that has given me a number of problems, but different problems. But now it seems to be healing again, and and I was chit-chatting with Dr. Clark. I'm happy to be here again, and all the doctors I've seen have come to the conclusion that hyperbaric has made a huge difference. But the other thing too is not the doctors too, but the staff here. You've seen the interaction when I walked in, it's made a huge difference because chit-chat to them, it made me feel comfortable, especially 2 years ago or 3 years ago when I first started. When I did the first session, I was so apprehensive going into a chamber and stuff, even though it's transparent, and stuff. But they assured me, and I stuck with it.